Good afternoon to everybody. It is 12 noon on the Friday. My goodness, it is February 19th. I am so happy to welcome you to the Healthy Flint Research Coordinating Center's community webinar on coronavirus. And I am your moderator, Yvonne Lewis. It has been my privilege now for 49 consecutive weeks to work along with this tremendous array of partners across Flint, Genesee County to bring to you information about the coronavirus with an express purpose to help you understand the local context to what we've seen now for almost a year, a global pandemic. It is so important that you've been joining us each week because you're helping us to get information out to everyone in our community that you come in contact with so we can really make a difference. Our goal here again is to ensure that we're making available to our community all the resources at our disposal to help us be able to make informed decisions and to understand how we can help ourselves and all the community members. Now, today we have an exciting program for you, and we really want you to stay tuned. I want to remind you, first of all, if you are in the Zoom itself, you can go down to that Q&A button and push that button and make sure you put your questions in. We have a wonderful array of panelists behind the scenes who are ready, willing, and able to answer your questions. And remember, if there are some that we don't get to in this session, we'll be sure that we can bring those answers to you in future sessions. It is also important for you to know that you can give us a call at 810-835-2130 if you have questions and you're not in the Zoom and you're not able to get those questions connected to us today. If you call that number or text that number, your question will be added to the questions that we'll be responding to today. And finally, I want you to know if you're on Facebook, we have someone monitoring that Facebook Live, and you can put your questions in there. And again, we'll do our best to answer those questions for you. So we want to welcome you again. Thank you all for joining us and give some really, really wonderful kudos to all of our partners. I do want to quickly interject right here. We've had one of our partners, Suzanne Kupel, who has been with us for most of the times. And some of you have not seen her in the last couple of weeks and have inquired about her. Want you to know that we want to keep her in our thoughts. And for those of you that want to send a word of prayer for her, she is on sick leave right now, but we are expecting her to be back in a couple of weeks. So let's just keep her in our thoughts as we move forward. Today, one of our great partners from the city of Flint, Dr. Lawrence Reynolds, is here. We know this is African American History Month, and during this month, we have done our best to bring some highlights to you specifically as it relates to those individuals in the African American community, or we often say African American Black community, that have lent their experience, expertise to the United States of America. Dr. Reynolds has been giving us highlights every week as it relates to especially the equities in the health arena. Dr. Reynolds, just want to open up and for you and I to have a quick talk. Where are we going today with our insights, our highlights on African American history?
Today, with great pleasure, I'd like to talk to you about Kizzmekia Shante Corbett. How many of y'all have heard of her? Okay, well, she's a 35-year-old PhD immunologist who led the team that worked on isolating the spike protein that everybody is making the mRNA vaccine with. So she had a key role there. And so why am I talking to you about her? First of all, she's not from a big city. She's from Hurdle Mills, North Carolina.
Dr. Reynolds, I've never even heard of Hurdle Mills.
She had a large family like mine of step siblings and foster siblings. She went to University of Maryland and calmed down, Dr. Verholden, Baltimore. and that's an important point because under Dr. Harbrowski at U of M, University of Maryland, Baltimore, he turned out more Black science and technology students than all the other universities in Maryland, including the University of Maryland main campus, which is 3 times as large. So I'll talk about him another day. But back to Dr. Corbett. Okay, she was from a small country town, and I'm going to have to find out where Hurdle Mills, North Carolina is. But she went on to University of Maryland, Baltimore County. Then she went on to get her PhD in microbiology and immunology from the University of North Carolina at Chapel Hill. Now, why am I telling you this? Because if we have any young listeners, if we have anybody who's still in school, and you're listening to people tell you, you can't do this, we don't do that, ignore them and look it up for yourself. Don't take my word for it. Look up Kizzmekia Corbett, Corbett.
Yeah, make
All
sure.
right. We have our Dr. Furholden. Well, the NIH has Kizzmekia Corbett.
Thank you, Dr. Reynolds. You know, I had a privilege a couple of years ago to go to Washington, D.C. and visit the National Academy of Sciences for a meeting. I was absolutely amazed at the number of African Americans and it was like a hallway of African Americans, like from the early 1800s to 1900s to now, that had an influence on our country's work in science, all the different kinds of sciences. So it's nice to know that we stand on the shoulders of great men and great women. And this young lady, you said she had the involvement of identifying this spike protein. And we're going to talk about this spike protein today because it's raising some really interesting questions. But we also wanted to say, as we look back at history, and you talk about, you know, I want you to talk about that Sankofi because you brought that forward in another work that we do. But if you talk about, we look back in order to go forward. So can you just give a little bit of history on that Sankofi?
Yes. Well, it's from a West African culture. And, you know, we didn't use, other than Arabic, one of the main ways of communication was using symbols. And the Sankofa is a bird that has two heads, one looking forward and one looking backward, because you have to know your past in order to know where you are and where you're going. And that's critical for us. And that's why when I talked about Dr. Corbett, I mentioned Dr. Hrabowski, because we all have someone who pushed us ahead. And I'll talk about Dr. Hrabowski another day. But we are all part of a chain. You've ever heard people say, "Let the circle be unbroken"? Well, let it be unbroken.
Now, Dr. Reynolds, you know, when you talked about Dr. Corbett, I saw Dr. Deborah Furholden light up, and I know she is chomping to get in here. You started this. All right, so
yeah,
you got something on
I had to because he did correct it. And I know Dr. Hrabowski and his wife I know his wife much better. And she went to UMBC, University of Maryland, Baltimore County. And if y'all didn't know, Dr. Corbett is going to be doing a live talk with me and Dr. EJ, who's our community dean in Flint. And we'll probably be inviting others in because we want to get as many in the community here as possible on Monday, June 14th, from 7:30 to 8:30 p.m. So thank you for bringing up this living legend, because there is a big time leaky pipeline in the bench sciences and the biological sciences that Black and brown people fall through all the time. And the fact that she was at the forefront of not just refining this new technology, but helping us to get a COVID vaccine out is something that we should all be very proud of. And she loves Flint, loves Flint.
So when you talk about Black and brown people being found in space, and in this whole space of the sciences, we're not in the pipeline like we need to be. There are various types of sciences, and again, we talk about this young lady coming from a small town, but you know, Flint's looked at as a small town too. And I want to bring forward to us today someone who is also making inroads in the sciences. It's not the hard science like biology and like you said, microbiology and immunology, but political science. And so I want to introduce to you today, if you've never met this young man, Dominique Clemens. Dominique Clemens is one of our newest county commissioners for the 4th district. And he has been advancing equity in Genesee County since his small or short time. He is also here in this position. He is also the Director of Diversity for the Michigan State House of Representatives Democratic Caucus. And I want to welcome, come on, Dominique, let's talk for a little bit, you and I, and then we got to bring Dr. Reynolds and Dr. Deborah back into this conversation. But Dominique, let's see your face.
Absolutely.
All right, so can you just open that screen up for us, Tay, so we can see him in full view, the gallery view again. So Dominique, I learned something about you this morning that it really amazed me. And you can tell your own story, but if I recall correctly, you started your work in the legislature at 19 years old, and you look like you just got out of high school.
That's right, and thank you for that. So I started getting involved with this political process during my undergraduate career at Michigan State University, interning for our Flint Senator, John Gleason, at the time, and really got hooked in that and saw the impact that folks can have in our community by getting involved in this political process. So Senator Gleason's office was really focused on constituent services and working with people in the community to address issues, folks that were unemployed or having issues, collecting resources and navigating state government. And from that, I stayed involved, and from graduating MSU, went on to graduate school at the George Washington University in DC, and came back and decided to make this a full-time career and a passion of helping people navigate government systems, and thought for the most part I would be that background staffer working in the legislature like I currently am doing. And being someone that's still very young, but having stuck around there for almost 9 years now is saying a lot when we have such a high turnover in the legislature. But what's been most surprising on myself was that I actually then went on to run for public office. Being that person that loved helping people and loved being the worker in the background, I never thought I'd be the one on the ballot out campaigning. But what it came down to is when my county commissioner was announcing her retirement, I was looking around at who else was going to run and was hoping that there'd be someone that came from a diverse background. And the fact of the matter is, in politics quite often, and even in our community here, there's not a lot of Black and brown folks that are recognized in elected positions, yet these are the folks that are making the decisions for us. Same thing with young folks. There's not very many young folks elected to office, but there's a lot of older Caucasian folks that are making decisions for young folks as well. So I made the decision to run for office so that my community could be represented by someone that looks like them, that is from this community and has lived the same experiences as them.
So Dominique, I want to ask you something. Now, in this last few months, last year was a credible year for us. We not only were dealing with the aftermath of the water crisis, but now we have a pandemic, and then we had social and racial unrest. And one of the things in some of the work that I've done is challenge us to ask ourselves a question about how we identify. Because sometimes, even though we are challenged, people make decisions about us when they look at us.
Mm-hmm.
And we often say there's not a problem, but it is a visual decision that's made. And so I want to ask you a question that I ask some other people when we're doing this work is, how do you identify?
Absolutely. No, that's a great question. It's been something I've had to work throughout my youth. So I identify as African American. I am multiracial. My mother is Caucasian and my dad is African American and Black, and I'm very proud of that. Now, growing up, a lot of folks looked at me and saw the color of my skin and saw the way that my hair was and made assumptions that I was Mexican or Hispanic. A lot of folks in the white community, looked down on me. I clearly wasn't white, but a lot of my brothers and sisters in the Black community didn't embrace me in open arms and often was told that I'm not Black enough. So that identity is something that's very important. It's something that I've learned to build up on, and really one of the words that comes to my mind is that intersectionality, that I absolutely 100% identify as African American, but I am a multiracial, multicultural individual, and every part of my identity is important.
And so the work that you've done with the county commissions, I want to take a couple minutes to just talk about this. Tell us about this initiative that you've been able to stand up since being a commissioner. And I understand 2021, you have a new role even on the county commission.
Yeah, absolutely. So won the election in 2020 and was sworn in just here in January. And the last month and a half, I have hit the ground running almost nonstop to get some work started because there's that much work to be done and we couldn't wait to get these things started. One of my biggest things was introducing this new diversity, equity, and inclusion committee here in the county. It's the first time we've ever done anything like this here in the county. And this committee is really geared towards looking at equity and inclusion in an all-inclusive lens to look at how we as a board of commissioners, the policies that we make, the budgets that we set, how is that affecting people in our community? But also looking at it on the internal frame of we have over 1,500 staff here in the county from the various departments and making sure that we're treating our staff in an equitable way and that they're being provided with inclusive opportunities. And those are the three words that get thrown around a lot: diversity, equity, and inclusion. And a lot of folks think they're the same thing. And I know all of you know here that they're all very different things and very important things. And the way that I always like to refer to it is diversity is getting folks into a room. Those are the numbers, that is the input. But then the outputs are equity and inclusion. Whereas diversity is the getting the people in the room, equity is making sure that those diverse people are at the table. And inclusion is making sure that every person that is at the table, that their voice is being heard, that their voice is being respected, and that their input is being valued. And that's really what this committee is looking to do, is make sure that everyone in our community is being heard and being valued and being brought to the table.
Thank you so much, Dominique. In this world that we're living with now, I'd like to ask Dr. Reynolds and Dr. Deborah to come into this conversation with us, because when we're talking about diversity, equity, and inclusion, we know that this virus, we thought, early on, they said the virus wasn't affecting the Black community. And then all of a sudden, we find, oh, that was not the right story. And so when we look at when we have this whole conversation now, I just want to focus the next couple of minutes on what work is being done to ensure that even in the midst of the coronavirus, there is equity brought to this conversation. Dr. Reynolds.
Well, I already started talking about our researchers, and I'll share with you. Dr. Corbett will not speak to any community group unless she's got members of the Black community in that group. So she is dedicated to diversity and inclusion in the way she operates. Now, as far as as far as COVID-19 goes, you may recall that it looked like we were okay, and folks were saying, based on what happened in China, Black folks don't get COVID because they had a couple of Nigerian students and they didn't get sick at that time. Okay, and as we learned more, and as the virus moved to the US, we started noticing, especially in my old neighborhood of Jamaica, Queens, New York, and Brooklyn, the numbers went off the chart for people of color, Black and brown. And we saw those refrigerated trucks. They had to bring in refrigerated trucks to hold the bodies because the morgue in the hospital was filled. So what gives? And then I get a call from a Flint Journal reporter, and he's asking me, well, why do you think people of color and Black folks especially get COVID? And I had to think, let me see. Many of us share a ride to work or ride the bus. Mm-hmm. Many of us work in those face-to-face jobs where we must face a number of people every day in restaurants, in nursing homes, in hospitals, and in so many other positions. And even when we have the credential, teachers got to do face-to-face. Okay, nurses have to do face-to-face. And we are in those positions, even when we think we've moved up economically, it exposed us to COVID. And then there's some cultural considerations that may overlap with other communities, and that is we have multi-generational households, or even if it's not mom, dad, grandma, and great-grandma, great uncles in the house, we still have them participating in the child care. Yeah. So all these things mixed together increase our risk. And then we have the issue of systemic and institutional racism.
All right, Doc, you gave it to us right there. So you brought it all in. And so, Dr. Deborah, you have a phrase that you've been saying to everybody you talk to in the last couple of weeks, whether it's CNN or NBC right here at home. How do we deal with this? What are your thoughts? What should happen?
We need to mandate equity. We have to mandate equity. I always tell people, and Dominique, you don't even know, I have 3 biracial children. They grapple with this same thing. They very much identify as African American. I have a daughter that doesn't look Black at all, like at all. And she's like, you don't get to define my Blackness by what your eyes see.
Right.
I just like listening to you. So what I say is, where there is will, there is a legislative way. Mm-hmm. We say if it matters, we make it a law. And the thing about laws, our laws are written and enforceable. So when we said seatbelt save lives, we made it a law. We didn't worry about most of the cars that were out on the road at the time didn't have good functioning seatbelts in the front and the back. We made the law, and then the world caught up to the law. Okay, so if there's a will, there is a legislative way. And if it matters, and if DEI, if diversity, and I love how you framed it, if getting people in the room, getting them a seat at the table and having their voice be valued and heard matters, we need to legislate those things and we need to mandate those things. And they need to have teeth to them, right? Gums without teeth. You ever tried to watch somebody eat an ear of corn with no teeth? It's real funny. They just basically mash the corn around. Those laws need teeth, and enforcement is the teeth. So when it comes to COVID, what we've done is we've missed the mark, and that the resource was rolled out to communities. The federal government gave it to states, and then they bypassed the states and started giving it directly to pharmacies and big box stores. So nobody can say who got what, the systems that we need in place to even track who's getting what, the system that we would need to find out if it's happening fairly. We don't have that. And in the absence of a law, the first time I broke curfew and nothing happened, what did I do? I broke curfew again. Right. The time I came home and my mom was sitting on the couch in the dark smoking a cigarette waiting for me, guess what I didn't do after that? After I got off of those 3 months of punishment, after there was a consequence for that penalty, I didn't break curfew anymore. So if equity matters, we need to mandate it. The minimum mandate is that the people who are getting the vaccine in their arms need to mirror the community and the community distribution within category of people on a week-to-week or at least a bi-weekly basis who are actually getting that vaccine in their arms. In the absence of that, goodwill, good intentions are simply not enough. People need real skin in the game. They need to know this is the law, this is the mandate. If you want the resource, this is what you must do. And if you don't do it, there's a consequence.
Thank you, Dr. Deborah and Dr. Reynolds. And Dominique, we're so thankful that you joined us today. I'm gonna give you 30 seconds because I gotta get to Gary Jones before he has 30 seconds. You have the opportunity to help us move some legislation and make some decisions. So give us 30 seconds.
Absolutely. So on that, the very base of it is stay involved and stay engaged. We as a community have to do better at educating ourselves and knowing what's happening in the legislative realm of things. So that is the very base of it. And then making sure that your voice is heard. We're going to get this work done if we do it together. Creating a diversity and equity committee means nothing if it's just me and one other person there. We need the community to be lifting up each other's voices and pushing for this change, for this legislative action. Where, as Dr. Furholden said, where there's a will, there's a legislative way. But in order to get that legislative way happen, we as a community have to influence those that are elected to make it happen.
Thank you, Dominique. And we're gonna hold you up and we're gonna hold you accountable along with others to make sure, because you can't do it alone. You need our voices along with you. That's so right. Thank you all for being with us today on this roundtable. And now we got to get to the next part, because when we talk about legislating things, our governor is in the House in Lansing to make sure some things go. So Gary Jones is here with us today as our community affairs representative at the governor's office to give us the insights from the governor's office for this week. Gary, give us those tidbits today.
Yep, thank you, Yvonne. I appreciate it. So Governor Gretchen Whitmer's third executive budget was released last week, And a big thank you to the Flint Center for Health Equity Solutions for their leadership, as well as recommending to policymakers to support those investments that promote equity inside of the budget. The executive budget recommendation follows a recent supplemental budget request for the current fiscal year that was sent to the legislature on January 20th, which would provide $5.6 billion in new funding for Michigan's recovery from the pandemic. That supplemental request requires action by the legislature to ensure the full benefits of the governor's My COVID Recovery Plan are realized. State task force urges new state policies to tackle root causes of poverty and to bring opportunity to more Michiganders. Lifting millions of Michiganders out of poverty will require bold new initiatives, expanded state policies, and a significant financial investment, according to a new report released by the Michigan Poverty Task Force. The group presented its findings, a list of 35 policy recommendations, to Governor Whitmer, who created the task force in December 2019, to identify new ways state government can help low-income Michiganders transcend poverty and build a better life. The governor also announced nearly 6,000 small businesses across Michigan were awarded $52.5 million through Michigan Small Business Survival Grant Program. Critical relief totaling approximately $52.5 million for nearly 6,000 small businesses across the state, including here in Genesee County, has been awarded to date through the Michigan Economic Development Corporation's Michigan Small Business Survival Grant. And lastly, I would like to promote the michigan.gov/COVID vaccine website, in addition to michigan.gov/coronavirus website. Those two websites are still the best catch-alls for everything either pertaining to the COVID-19 vaccine or coronavirus in the state of Michigan.
Thank you so much, Gary. Appreciate it. You take the time out to come and share directly from the governor's office with us. And as you said, we want to remind everybody, your information slide is up. If you need any information at all between our webinars, Gary is ready and able to answer those for you. So please be sure that you give him a call at 517-282-3193 or visit the website, and you can always email him at any time. Well, any last thoughts, Gary, before you have to leave us today?
Nope. Just stay inside, stay warm. It's the only advice I got.
Yeah, on top of all the other things, we've had some really interesting weather, haven't we? So thank you so much, Gary, and be safe out there. Dr. Holden, you just left us with this huge mandate, right? But something that you're doing every week through the Flint Center for Health Equity Solutions. You're also sitting on the governor's task force, and we just heard a great shout out from Gary Jones on that. But you're sitting on the Flint coronavirus task force. You're on some task force in somebody else's state.
The New York City task force, and now the representative from the governor's task force on the Protect Michigan Commission.
I'm telling you, Dr. Deborah, why, Dominique just told us it's important for our voices to be heard. And clearly we know everybody can't be at every table, and some tables are only having one or two representatives. What you're doing is so powerful for our community, and we want to thank you because you're working behind the scenes in so many other ways. But tell us how this policy brief can really make a difference.
Yeah, great. So it has the data. That's the first thing. And I do believe knowledge is power. If you know, at least you have the choice to act on that knowledge. And so we worked in partnership with the Genesee County Health Department. And I'm really excited about that work with them. And I want to acknowledge my great colleagues, Dr. Rick Sadler and Suzanne Cooper, who really were the two who took up the mantle. We have a great data dashboard now. We used to only be able to talk about total numbers. Now people can look at trends. And if they want to understand what's happening in their own community and compared to other communities, you have the capacity to do that. You want to know what the rates look like in your age group or in your neighborhood or in your racial group, you can do that. And so I really appreciate them. So we're now 3 months out of consecutive decline in Genesee County. Flint this week didn't go down a lot, but the rate is held constant. And our community case rate, we've hit that sweet spot. We've dropped finally below 3%. I think we were at 3.4 last week. We're at 2.9% this week. That's good news because testing remains strong. So people continue to get tested, and the number of people who are coming up positive is going down in our community. Where are we with the vaccine? We've had nearly 40,000 of the first doses administered in the county. Almost 12,000 second doses have been administered, and we have more than 57,000 people registered. I remember when Dr. Hacker said 2 weeks ago, we had a wait list of a little over 30,000 and it was growing by 2,000 people a day. Well, you do the math, that was 2 weeks ago. And now that's held true. We got over 50,000 residents. So the numbers look like this, great trends going down, doing a great job at dealing with some of these unknown in the race category. Again, when I think about mandating equity, the only way for us to know if it's happening equitably, right? If the vaccine's being administered equitably, if we're really continuing to keep that racial gap in COVID cases and deaths closed, is we've got to have the data. So I also acknowledge the great work of many, and we are doing a lot better than a lot of other places on having that data. So next, what we're doing to try to prioritize people is we're bringing two potent indices to bear. The state has an approach that they're using for within categories. And in our county, we're looking at who really is at most risk for a bad outcome from COVID. Because with a wait list of 57,000, you don't want to treat everybody in line the same, right? And it's hard because we're in a situation now where supply is small and demand is big. That's why we were having these conversations early on, well before the vaccine came out, trying to get people's questions answered so they could make their minds up so that when your number comes up, you would be in line. And so I just want to reinforce for people, you don't lose your right to be in line, but you might lose your place in line. You might lose your position. So Dr. Hackert and others at the health department and in the community have said, let's bring some good data to bear to help identify and prioritize people in that line. And so we've got something called the Social Vulnerability Index. It was developed by the CDC. It's been used in multiple states and counties all across the country, not just for COVID, but for other things that predated COVID. Uses 15 basic indicators that come out of the census data, and that will be used to help us prioritize communities for COVID vaccination. So if you live in one of the communities that are high on social vulnerability, that will help to push you further up in the line. We also have another measure, again, similar to the Social Vulnerability Index. The Distress Index uses just 4 variables from the census to identify communities with greater economic deprivation. That means they lack a lot of the kind of basic resources that we know communities need to be vibrant, right? And that includes things like, when we talk about vibrant communities, it's also related to health. And I've done stories on this. A lot of people don't live near a pharmacy. A lot of people don't live in a community where they have a grocery store that they can walk to or get to in a short car ride. So we've mapped this out for the health department. They're also using this to integrate and try to prioritize people on the list. And that's within categories. That won't supersede the categories. Okay, so we're still dealing with categories 1A, 1B. I think we're moving into 1C. We've added some new groups to those categories. They've broadened the definition of essential, right? Schools reopening, so teachers have been added and things like that. But we're really trying to be good stewards of the resources that we have and get it into the arms of the people who are most at risk for both contracting and also having a bad outcome. All right, I'm gonna throw the ball over to my colleague here. She's gonna, Mary Catherine Crawford, the Health Equity Brief is her brainchild, and I'll toss it over to her.
Thanks, Doc.
Mary.
Hi, Yvonne. Good afternoon to everyone. So if you didn't get the brief, you need to get signed up. So I'll go ahead and throw that link in the chat so you can get subscribed in just a second. If you do have any questions, you can about what Doc just shared or the brief in general, you can go ahead and shoot me an email at crawf457@msu.edu. So Doc talks about how, we as researchers are ensuring equity in our communities, but what about our lawmakers? So last week, as Gary had mentioned, Governor Whitmer's 3rd executive budget was released, and it contained significant investments to promote equity. So we're calling on our policymakers to support and allocate the proposed funding amount to establish the Race, Equity, Diversity, and Inclusion Office that would result in more equitable and inclusive services administered by the Department of Health and Human Services. And second, we want to see the full $8.4 million to improve health access to insurance and add other forms of social support that would help to significantly reduce health disparities. We want to see that preserved as the budget talks move forward. And law and policymakers should also continue to mandate equity by engaging the Black Leadership Advisory Council in their advisory capacity to prevent disparities from widening and furthering racial inequity. And finally, this prejudice can also be countered just by the continued requirement of implicit bias training for all MDHHS employees as well. And then, from what we can do as community members to help with the COVID response and equity, you can visit gchd.us/coronavirus to find some great volunteer opportunities. And then also, we just want to remind you to keep using the free My COVID Alert app so that you know and understand your risks of exposure and can take appropriate measures. And then any questions about the data, please email my wonderful colleague, Rick Sadler, sadlerr@msu.edu.
Thank you, Mary Catherine, and you gave us a good segue. We appreciate all that information that we know we can get involved as community because our voices count. And I hope that's coming through very, very clearly today, how important your voice is. So even on this webinar, your voice counts. Please continue to put those questions in the queue, or you can send them in to us. We want to make sure we're responding to your questions even today. So we just heard Dr. Verholden and Mary Catherine talk about the importance of data and how that data can help make decisions. Well, we want to follow the numbers, but we also want to follow understand the sciences. So last week, Dr. Woolford, we're going to ask her to come forward. Dr. Woolford shared with us some very interesting information last week. Asked her to talk about the mutations and the variants. And she started talking about that. So there's one from South Africa and there's one from Britain, South Africa. And then there's one from Britain. And I need you to help me, Dr. Woolford. Tell me and help me understand more about these different variants. Whoa.
Hi, Yvonne.
Yeah.
Thank you so much for this opportunity to share again about this. So it's important to think about the virus as we have discussed before. And with this virus, we know that there are two parts of it, right? There's the fatty layer on the outside that can have other things on the outside as well. And then the recipe on the inside. And as Dr. Verholden says, that's the real thug. It's the recipe on the inside that really does the damage. And so that's what the virus looks like. And then we know that what can happen is that mutations can happen. So when they make copies, which is what the virus wants to do inside our body, right? Once it gets into our body, it wants to get into the cell and make copies. When it makes those copies, it makes mistakes. So here we see it was green, this time it's blue. And if we think about that mutation, that the cell that has the mutation in it is called the variant. And let's think about this variant being the British variant, right? The one that's the B117 variant. So what's happened is that there are other variants, and we have the South African variant that incorporates some of the changes that are in the British variant, but adds additional mistakes as well. And that's what makes that South African one a little bit more concerning. I'm going to show you why. So remember we said that the COVID virus has these spike proteins on the outside. Its fatty layer happens to have these spike proteins on the outside. And we talked about what that spike protein does. Now, it is just part of the like a pineapple has the pineapple spikes at the top. It is just happens to be on the outside of the virus. It can't do anything by itself. It's like a bark, but with no dog. The dog is on the inside that can do the damage, but the bark is just the bark. It just tells you that there is a virus there. That spike protein happened to have a shape that was able to fit like a key into the lock on our cells. And just as a side note, Dr. Corbett's work with this spike protein is so phenomenal. And one day we have to go into that a little bit, because as you see, the spike protein has different parts and it folds in different ways. And you need to make sure it stays in one folding pattern. And she looked into all of that and discovered phenomenal things about that. But another day for that. For today, that spike protein happens to be able to unlock the cells in our body by connecting with, by opening that lock. What happens with the variant is that if we think about the British variant, it changes the end of that spike protein to make it fit better into the lock. So rather than just jiggling it and letting it, getting in, it really opens it easily and really opens it quickly so that the cells, the virus, the whole virus, if the spike just got in, it wouldn't be a problem, but the whole virus gets to go in. So now, vaccines. The vaccine, when we put it in our body, it gives us a recipe, but this is important, not the recipe for the whole virus, just the part of the recipe for the spike protein. And that goes into our cells. Now our cells have the recipe to make the spike protein. It makes it, puts it on the surface of our cells. And now our body is like, whoa, there's something different out there. Let us make antibodies to fight off that spike protein. So this is great because we don't actually have the virus. It's not trying to kill the virus because the virus isn't in our body. It's just that spike protein. It learns how to fight that off, how to recognize it and make the antibodies that will fight it. And so it makes these antibodies, and that memory, that knowledge is there if we should in contact with the actual virus. If our body now sees the actual virus with the variant, here's the question. Does the antibody that was made to the original spike protein, will it work with this variant? And with the British variant, it seems to still work. Those antibodies can still attach to that spike protein and block it. You see, it cannot get to use its spike protein to open the cell anymore. It can't use it. It's being blocked by the antibodies. And so the virus can't get into the cell. It can't do any damage. That's the British one. Now to the South African one. The South African one has the little change in the end of the spike protein that makes it open better, but we know the antibodies from the that we create because of our vaccine can still protect against that. But the South African variant has another mutation, another change. So not only does it have that better key at the end, now it has changed some other part of that spike protein, but this part, does it affect the antibodies? The question is, or the answer is, it seems to. When the antibodies try to attach to block it, this new little mutation gets in the way and doesn't let that antibody fit well. So that antibody can't do its job as well. So while the antibody can try to block the key, it doesn't block it very well. And so it is true, our vaccines are somewhat less effective against the South African variant than it is against the original and the British one, but it still works. You see, it kind of hangs on there. It kind of still helps. So it is better to have the vaccine than not, but it isn't as great as it was against the original virus.
Thank you, Dr. Wilford, because the question was, if it's not as effective, should I still get the vaccine? And you just said yes.
Yes, and I will give you another reason why you should still get the vaccine. You should still get the vaccine because one, yes, it still works, though not nearly quite as well. But remember, vaccines do more than one thing. So when we think about the vaccine, that little, as I say, that little recipe goes into our cells, has our cells make the spike protein. And now there are cells in our body that, oh, I wanted to make that point, that when after that mRNA gets into our cell and makes the spike protein, it goes away. So it cannot get into our DNA. It cannot cause disease. It cannot change our DNA. So I wanted to make that point. But it puts the spike protein on our cells. And then there are cells in our body that go around looking for abnormal things in cells in our body. And it recognizes that that is abnormal. And those T cells go in there and kill the cell. But it's learned how to find those cells with the spike protein. So those T cells protect us as well. So even if the antibodies are not working as well, we also have T cells that are going to be around and that they are going to protect us also when we actually come in contact with the virus. So get the vaccine because it has multiple ways of helping to protect us.
Thank you, Dr. Wolfer. Appreciate you giving us that. Now, and I just will tell you now, I need a new lesson. So you're gonna talk about T cells, but vaccinations are important, and you're saying it is the self-defense for our bodies. So,
absolutely, self-defense for our bodies. It protects us in a number of different ways, and so it is important to get them, even though we have these variants. The vaccines will still help us, but we still have to keep doing surveillance. We still have to keep checking for more and more variants to see if the vaccines are working, and then change our vaccines if we need to make them more effective. But as of the current situation, they are still working and are still helpful.
Thank you, Dr. Wolfer, because you really helped us to understand then why it's important for us to continue to get testing for the virus. Because when they test and they find someone has it, they can then look at those antibodies and do all that scientific work to make sure we've got the proper vaccines for the viruses. So I want to invite now, again, thank you, Dr. Wolford. I want to invite now Jean Troop, who is the new executive director for the Genesee Community Health Center, and it works at Genesee Health Systems. They are now working on continuing to provide opportunities for us as community members to get tested. And she has some good news about vaccines availability. Jean, welcome today. This is your first time being with us on the webinar.
Yes, thank you for having me. I appreciate it. And we're excited to have partnered with the health department in order to provide some vaccine. But first, I'll talk about some testing that we're doing. So we did receive a grant from the state that allows us to do mobile testing, and it also allows us to do additional testing at our health center. So right now we have both rapid testing. We have a Sophia machine that does the antigen testing, and then we also have some Binex cards that'll provide a result within 15 minutes. And then we also are doing the PCR testing, which it goes to the lab and it takes a couple of days. We're doing regular testing currently at our Atherton site, which is on Center Road. And you'll see the flyer up in just a few minutes on the dates and times, but we are doing that twice a week. And then also we are doing some mobile testing. We've been out in the community since April of last year, providing mobile testing. And what that means, we're trying to reach those people that aren't able to come to us or have the opportunity to get transportation to come to some place to get testing. Like you said, somebody said earlier, they don't always have a grocery store that they could walk to or a pharmacy that they could walk to. Well, we tried to go to them. So we've been to the homeless shelters, we've been to other congregate settings, and we've also done some work at SUD facilities. We've done mobile testing at the deaf and hard of hearing communities, Latinx, and again, for over 65. And then on the vaccine itself, again, I want to say thank you again to the health department for partnering with us, recognizing the need in our community to get more vaccines out. We are on a target population right now using the homeless, same target population we used for our testing, we're using for our vaccines as well. And we are working to get that mobile. I know there's a lot of questions out about the elderly or homebound patients, and we are working very diligently to get a process in place to be able to reach those people. The challenge that we run into is the vaccine and the I call it volatility in the vaccine handling, but it is that currently we're using Moderna vaccine. It comes in vials of 10 doses each. It requires a specific temperature to be at and it has limited shelf life once it reaches a certain temperature. And once it's punctured to do one vaccine, then there's limited. So a lot of logistics involved in doing this, but we have started our vaccines a couple of weeks ago. We vaccinated 75 people so far with both doses. And now we're up to 320 vaccines overall. And we just received the vaccine about February 4th. So we're pretty excited about the work we've done so far. Obviously, it's just a small dent in the community, but we are trying to reach those people that wouldn't otherwise be able to get it. So our focus isn't just on patients over 65. While we're keeping with the priority groups, we've been allocated to get into the congregate settings as well, and in the homeless shelters and that, like we have up here. So these are the ones we've done so far. We've been to Carriage Town, we've been to My Brother's Keeper, we've been to the shelter of Flint. We vaccinated the staff at Whaley's, and that was a mobile vaccine, so we took the vaccine to them. We have immunized our staff and also the community members over 65. And again, Salvation Army, we went there mobile. We're working right now with Odyssey House to potentially go out there and do a mobile clinic as well. And then our group homes in the county. And here's the flyer for the COVID testing that we have. Again, it's both, we have both testing. So, and we have had several positives lately, which is nice to be able to do the rapid testing, because then we can give them the answer right there and we can get them in quarantine right away versus not knowing. And then we also work with our community partners, of course, so many of you are on the phone today, to help provide the resources to these families. So we do appreciate the being part of this and getting the word out.
Thank you so much, Jean. I just want to go back and just because there's so many questions about the availability in the mobile unit, and you made two very important points. One, you said shelf life. That's how long you can keep that vaccine out of a refrigerated condition before it's no longer useful. And so the really important that plans are being made. And so what should we expect? Should we will you continue to come and keep us updated as to what those plans were? And what else do you think people need to know about the mobile unit?
So yes, we will certainly keep you updated on that, and we appreciate the opportunity to do that, because the more people we can reach, obviously, the quicker we can get this virus under control. The one thing I want people to know or to think about is to educate yourself on testing or the vaccine, and make sure or get the vaccine like we talked about today. You heard why it's important to get the vaccine, and we need to make sure that in the community, everybody is aware of why it's so important to get the vaccine. We have about a 60%, we're looking at about a 60% rate of acceptance on getting the vaccine. So we have right now, luckily with the health department's partnership, we do have the quantity that we need at this point to do what we're doing. And so we want to make sure that people are aware that get vaccinated, because it will help.
Thank you, Jean. And for most of us, we know that there's registration processes to get the vaccine. So please, if you are wanting to get vaccinated, particularly if you're a senior 65 years of older, be sure to go to that health department website and get your name on their registration list. I want to go, thank you, Jean, so much. And we'll look forward to have you back with us. Quickly to some announcements. In addition to the opportunities at Genesee Health System over in Burton, we want to remind you that we have the community sites at the 3 churches that are still being stood up. We have Word of Life Church on Atherton, Bethel United Methodist Church on Ballinger Highway and Macedonia Missionary Baptist Church on Saginaw Street, North Saginaw Street. We continue to bring this to you because we want our community members to continue to get tested. As Dr. Wolford told us earlier, there is a variant and we have found that variant here. If you get tested, it's identified, then our team here in Flint that's ready and able in Flint, Genesee County to help us can know what needs to happen. You can also go to Walgreens, Hamilton Community Health Network, or Rite Aid in your areas. Please share this information with other community members so they too can be aware of their status and understand where and when they can go to get the actual vaccine when they're eligible. Now I want to invite Dr. Reynolds back because we've been saying to you there are three very important things we want you to remember. And Dr. Reynolds, I call him the Flint doctor, the doctor for Flint, advising our mayor. Talk to us about these 3 W's and a resource that's available and how that resource should be activated.
And I will say, before you got your vaccine and after you got your vaccine, you do the same thing. You wear a mask, you wash your hands, you watch your distance, you watch the crowd or density, and you watch the duration, how long you are in a crowded situation. Okay, duration and the number of people increase the viral load that you may come in contact with. So you want to reduce your risk by wearing a mask that fits properly, washing your hands, and watch your distance, the duration, and the density, the number of people who are in that location. And remember, you can always change your plan. If you arrive at a place and it doesn't look right, turn around and walk out. Now, sometimes when people get a report that they are COVID positive, or they've been in contact with someone who's positive for COVID-19 disease or the virus, the coronavirus, their mind goes blank. And the care provider is talking and it's like, wah, wah, wah. They don't hear what's being said. And so I'm asking all our care providers and referral sources to keep in mind that we do have COVID-19 quarantine and isolation care boxes. You can get them by calling the Greater Flint Health Coalition chat program at 810-953-2427. The referral must be made by an agency. It cannot be made by the individual, but we can help you through chat. Because say if you're talking to a family or a patient and it looks like they've zoned out, or you know they're going to have some questions, if you make that referral to CHAP, CHAP will call the family. Because many times the people may live in one place, but because of the situation may have to go to another place for care and support. So remember, it's the care boxes, and it includes gloves, masks, and most importantly, a thermometer, especially for people who are in quarantine or people who are monitoring their symptoms. It includes bleach and other cleaning solutions. So it's important. We can't just send our people home and say, stay in the house 10 days until you're symptom free, or 14 days if you're on quarantine. We have to give folks who need the tools to change their situation.
Thank you, Dr. Reynolds. That is CHAPS. Give that number again is 935-2427. Now, talking about other resources. Did I get that number right, Dr. Reynolds?
No, 953.
953-2427. Now, in these last couple of minutes, there's some other important resources that we want you to understand. If you're looking for some help balancing out what's going on in your life and you're feeling overwhelmed, you can join the coffee coffee and conversation with the Genesee Health System. And you can see this information. Please go on their website, www.flintparent.org, to get that information and join this conversation. It's a partnership between WeCast, Genesee Health System, and Community Education. We also want you to know about another resource that's coming up next Thursday. Hope starts here. It's a virtual resource summit. The information is here. If you're not on the Zoom, please go to the call Kenyatta Dotson at 810-600-9182. Kenyatta Dotson at 600-9182 to get that information about the Hope starts here. And I want to let you know you can still get CEUs, community health workers. Make sure you fill out that survey at the end to get those CEUs. And finally, as we close out today, we want you to know that you can join us, like us on Facebook, subscribe to our YouTube channel, Healthy Flint, email us questions for more information at info@hfrcc.org, and give us a call at 810-835-2130, and we will be happy to answer any questions that you may have. I appreciate you, along with our partners from the Healthy Flint Research Coordinating Center, for joining us today. And we want you to know we'll be back here next week for week 50, and you don't want to miss it. Next Friday at 12 noon. Join us. Thank you for joining us today.